Good evening and welcome to our COVID-19 update. I'm Ade Okeuyami. Here are the highlights at this hour. Federal government expresses worry over possible spike in cases as schools continue to reopen after the COVID-19 shutdown. Plans National Testing Week. Following President Trump's COVID-19 positive test treatment, disagreements break out over the mode of conduct for the next presidential debate ahead of the election next month. We'll begin tonight from Abuja, where the Presidential Task Force team resumed its briefing after the last one on the 29th of September, which was more than a week ago. Its chairman, Boss Mustafa, explained that although the casualty figures for COVID-19 are reducing moderately, all efforts should be in place for continuous testing. Mr. Mustafa added that the team is putting up plans for a national testing week, which will cover all local governments in the country.
In order to ramp up testing, the full implementation of a national testing week will be confirmed shortly, where we will go out and test in each and every local government of the Federation. Although Nigeria is no longer in the top 5 countries by cumulative deaths in Africa, the Presidential Task Force continues to urge Nigerians to change their attitude of skepticism and nonchalance to the virus. For the avoidance of doubt, the virus is still real, ferocious, and deadly. We still urge, however, that everyone should get tested because testing is the only way to detect, isolate, trace, and treat. Media reports have suggested that many Nigerians do not trust the government and its agencies. We need to continue to build mutual trust between government and the governed if successes already recorded are to be sustained in the fight against COVID-19. The Presidential Task Force and relevant agencies are working with the European Union on the issue of flights into Nigeria. As soon as negotiations are completed, Nigerians will be informed accordingly. For flights currently allowed into Nigeria, we are seeing a combined number of 4,500 arriving passengers per day into Lagos and Abuja.
Meanwhile, the Minister of Health, Dr. Ade Okeuyami, is asking Nigerians to desist from visiting countries of high health burden. Dr. Okeuyami explains that analysis shows that West African countries presently enjoy a low caseload and fatality ratio compared to other continents. He was speaking during the PTF briefing today.
The Federal Ministry of Health will be organizing a primary healthcare summit in the second week of November to unveil the agenda of the President on basic health care and the areas of emphasis in our march towards universal health coverage. Basic Healthcare Provision Fund is in full operation and all eligible states have received their allocations. We particularly appreciate the allocation to the Ministry of Health in this year's budget, which will allow us to spend sensibly and towards achieving goals of universal health coverage. The Basic Healthcare Provision Fund, the new manual of 2020, will be formally presented during the day when the Health Summit is holding.
Meanwhile, the Director General of the Nigeria Center for Disease Control, the NCDC, has been speaking about latest developments from the agency in the fight against COVID-19. Dr. Chikwe Ihekwazu says 2 diagnostic test kits based on antigens are to be introduced for better and effective usage. Dr. Chikwe Ihekwezu says although the new test kits will not replace the old ones, which are based on the PCR model, there will be guidelines for their use.
This outbreak has provided us an opportunity to complete the rollout of SOMAS. SOMAS is a digital case-based surveillance system to every local government in the country. This was a very slow and painful process, but the effort, energy, resources that have come in to support this outbreak has led us to accelerate the deployment of this digital surveillance tool that will not only improve the surveillance for COVID, but also improve the surveillance for all infectious diseases in the country. This has also been deployed to points of entry, airports and major land borders, working with our colleagues in port health services. And these are one of the innovative approaches through which we will improve the system altogether, and not just in response to the current outbreak. Finally, we've been working extremely hard with our colleagues in the Federal Ministry of Education to publish guidelines on a safe reopening of schools. Many states have already gone ahead, some are going ahead over the next few weeks, and the federal government, through the Federal Ministry of Education, has just announced the reopening of federal schools, primary and secondary schools. So we've been working with the Ministry of Education. There's no undertaking stakeholder meetings across the country. We have to find the balance between science and what is possible in our context. So it is not enough to say, do this, do that. We have to approach stakeholders, understand the circumstances in the schools, the facilities they have, the resources available, and reach a compromise between safety and being able to open.
And the National Coordinator of the PTF on COVID-19, Dr. Sani Aliyu, has also been speaking about safety protocols during the forthcoming Ondo governorship elections due this weekend. Dr. Aliyu, while briefing newsmen at the PTF today, explained that there will be the enforcement of strict compliance to all safety protocols across the 3,000 polling units in Ondo State.
We urge everyone to strictly comply with the INEC guidelines that we have worked with INEC to set up with regards to safe elections. We encourage all 17 political candidates of the Ondo elections to please lead by example. Public safety is our main priority, and we urge voters, candidates, and all election officials to adhere strictly to the safety measures that we have put in place with INEC. We must work together to ensure that the protocols issued by the NCDC, PTF, state committees on COVID-19, health authorities, and INEC are observed. We certainly cannot afford to lose the little gain we have made in the fight against the pandemic after the elections.
Dr. Aliyu also used the opportunity to talk about the international travel portal set up by the federal government. He insists now that payments for tests that are compulsory can be done at the destination. Here's Dr. Aliyu.
We urge everyone to strictly comply with the INEC guidelines that we have worked with INEC to set up with regards to safe elections. We encourage all 17 political candidates of the Ondo elections to please lead by example. Public safety is our main priority, and we urge voters, candidates, and all election officials to adhere strictly to the safety measures that we have put in place with INEC. We must work together to ensure that the protocols issued by the NCDC, PTF, state committees on COVID-19, health authorities, and INEC are observed.
We do apologize for the mix-up there. President Muhammadu Buhari has called on the National Assembly to pass the 2021 budget on time to ensure early implementation from January next year. The president was speaking after the presentation of a 13.08 trillion naira budget proposal before a joint session of the National Assembly. The president also told the lawmakers he had directed supervising ministers to monitor revenue-generating agencies of government. He lamented that revenue generation remains the major challenge of his administration.
The Nigerian economy is currently facing serious challenges, with the macroeconomic environment being significantly disrupted by the coronavirus pandemic. Real gross domestic product growth declined by 6.1% in the second quarter of 2020. This ended the three-year trend of positive but modest real GDP growth recorded since the second quarter of 2017. The 157% increase in capital allocation to the health sector is to enhance the capacity to deliver healthcare services through the procurement of equipment, vaccines, and other facilities. 2 centers of excellence, as well as 1 accident and emergency center, will be equipped in federal teaching hospitals in each geopolitical zone. In addition, numerous primary health care centers will be equipped and upgraded across the 6 geopolitical zones. Furthermore, funds have been allocated for the expansion of midwives service scheme in the 6 geopolitical zones. To enhance occupational safety, funds have been provided for the provision of personal protective equipment for health workers.
Meanwhile, UN Habitat has chosen Karu local government area of Nasarawa State for its COVID-19 response and recovery strategy for sub-Saharan Africa. The community will benefit from a $200 million intervention, which will be a pilot in Nigeria by the United Nations program to assist communities embark on a path to sustainable health and urban development. The national consultant for UN Habitat in Nigeria, Mr. Paul Okunlola, disclosed this during a visit to Governor Abdullahi Sule at the Government House in Lafia.
UN Habitat has secured a grant, a modest grant from the Swedish Development Agency, SIDA, for the purpose of intervening to curtail the spread of COVID-19 and assisting communities to embark on a path to sustainable health and urban development. What this project seeks to deliver are 3 key outputs. The first one is installation and commissioning of 6 emergency water sources. Many people cannot, hand washing, as serious as the COVID pandemic is, the solution is really quite simple. Wash your hands, socially distance, and keep yourself clean at all times. But when they don't have water, how can they do this? So we intend to install at least 6 water sources, boreholes, hand washing stations, and other health and hygiene interventions in peri-urban settlements. These are not the usual rural hand pump boreholes. These are solar-powered boreholes, and we're hoping that in doing this, we'll also build a community around those boreholes where people will be able to access water and they will own the boreholes.
Today, it is Nasarawa State that is benefiting. I'm not looking at it as Karu benefiting. It is actually Nasarawa State that benefited. Because at the end of the day, when you do this, you are doing it for our state. In the whole of the country, you selected Karu as a local government for this gesture.
The Kaduna State Ministry of Education has approved the reopening of the state university. A statement by the Public Relations Officer of the Ministry of Education, Adamu Bargo, says the resumption is to enable the students sit for the first semester exam for the 2019-2020 academic session, which will start on Monday, October the 19th, 2020. The ministry advises students to check their respective faculties for the exam's timetable ahead of the resumption date. It also warns all staff and students that they are to observe COVID-19 protocols by practicing social distancing, wearing of face masks, washing of hands, and the use of hand sanitizers at all times. We'll take a break now, and when we return from that break, we'll bring you the latest in the figures from the NCDC. Please stay on with us. Thanks for staying tuned. Welcome back to our COVID-19 update. About 545,364 tests have been carried out so far, with 59,739 cases of COVID-19 confirmed in Nigeria. Data from the NCDC shows that Lagos holds the top spot for testing by a wide margin. That's the number, 136,514, followed by the FCT with 63,896. Kano is in third place with 46,967. Rivers has 34,021, and Plateau 31,777 in fourth and fifth place. At the bottom are states like Kogi with 250, less than 300 samples tested. Kebbi and Yobe with 867 and 857 samples. As of today, every state and the Federal Capital Territory has at least one laboratory to test for COVID-19. And according to the NCDC, the tests conducted in those facilities within the NCDC molecular lab network are free of charge. The center reported 155 new cases from 8 states last night, with Lagos topping 84 cases, Rivers 31, Kaduna 12, Osun 10, the FCT 7, Oyo 6, Ogun 3, and Kwara 2. While no death was recorded till date, 400 and 3 cases have been discharged across the country after 95 persons recovered in 5 states. Plateau had 57 of that number, Rivers 16, Kaduna 13, the FCT 8, and Oyo had a single case. Let's discuss now with Dr. Ade Okeuyami, who is a consultant public health physician. Dr. Okeuyami, welcome to the program.
Thank you for having me.
Let's start with the figures, the figures I just read. What do you make of them? Are you joining the train of people who think, yes, finally we've got a hand on this?
It's better than previously. We still have the highest in Lagos, but of course that's where we have the airports and all of that. We have more testing centers there, and so likely more of those will be reported in Lagos. What may be more satisfying is to also know, okay, these were tests in all other states, and these were the numbers that were negative, and these were the numbers that were positive. That gives us a lot more picture. Certainly more settling than previously, but not yet time to raise our hands in the air. Because in other countries, we're still seeing that rise again. And for that reason, we should be careful. We've opened our borders, slightly more. It's getting back to normal. And with those countries feeding into Nigeria, we have to be careful. The schools are open. That means that the interaction that wasn't there between pupils, children, teachers is now there to let anything that gets into there become really difficult or, really, troublesome. So, yes, it's better than before, but we have to keep it going. We have to keep those preventive measures going while we wait for a vaccine.
Well, the preventive measures on one side, the testing on the other. If you take a look at the figures, just over 500,000 tests have been conducted over this period, which is about 6 or 7 months, out of a population of about 200 million. Someone told me something scary today and said that if about 59,000 are positive cases out of about 500 and some, that's about 9-point-something%.
Yeah.
If you extrapolate that to the population, the total population of the country, and discount for all the other states that are not doing as many tests as Lagos, the FCT, Rivers, and others, the number is quite significant.
Well, I mean, that may not be a true denominator, because the people who were tested are those who for one reason or the other,
brought themselves
forward, either because they were symptomatic or much more now, it's not even symptomatic. It's not about being symptomatic. People are testing either because they have to come in,
or
go out, resume somewhere. So we're having more non-symptomatic testing, as it were. And if that's the case and we still have these numbers, it may be a snapshot of what is really happening. But a more, scientific way to really say this is what is happening is to go all out and say, okay, let's go to all the states, let's go to local governments.
Which is what the federal government says it is planning now. They're planning something called a National Testing Week.
Okay.
Which they're working on. Just is as if you were there at the level of the states and the local governments.
Local governments.
Can we really do that?
We can. I mean, what would then be is that, would it be cost effective to do that? But with kits now available, I mean, we have ours, we're manufactured here, but there's still the logistics of machine training and supplies.
Right.
But there are two other kits that the World Health Organization announced that is as cheap as $5 or less. If we have that kind of screening tool that is not very invasive, is quick to test, is easy, not so much going to be stressful, and, we can
get the results quickly also.
Quick results that are near good enough in terms of specificity and sensitivity. It really may just tell us where we really are. And there's also the people part, what's the trust level now, generally? I mean, some just said, look, it was a scam, let's
forget about this and let's move on.
Move on. So there's still that thing about getting their trust to say, please come out and do this test. Let's actually know what the situation is. And it is worth doing, because for now we're saying open up, because the benefits of not opening up is what we can't quantify in terms of what we're losing. So as much as we are saying that for the sake of students and so on, the economy, then we should also test to truly prove that we're safe in this opening up that we're emphasizing.
That we're doing.
Yeah.
Every physician, every single physician, and you've just repeated it again,
yeah.
This whole issue of the test. The new tests that the WHO has just approved under certain conditions can be used are antigen-based tests.
Yeah.
Walk us through the difference between that and the PCR, apart from the cost and the duration of the test. Why is the PCR so much better than the antigen-based test?
Okay, so while the PCR is essentially going to tell you if the virus is present in the person, the antigen test will tell you if the person has had an infection in the past and therefore the body has now developed something else that you can see. So if I do an antigen test on you and it's positive, was it a year, was it 10 weeks ago that was it 2 weeks ago, was it a week ago, so I can't then say, because it is positive, will I then stop you from maybe
going anywhere
doing this or doing that? Whereas the other one can tell me that
you still actually have it, or you've just got it.
Or you've just got it. So, but the more of these antigen tests are, being worked on such that it can still give you a window of this is in the last 5 days and this is in the last number of days, such that can still be a guide. Therefore, we can't throw it away completely, especially when we consider the cost of doing one versus the other.
The other thing, of course, is that this Saturday, we're going to have elections again, this time in Ondo. Mm-hmm. The run-up to the elections were just like the ones in Edo. Very little social distancing, most people not wearing masks and so on, which doesn't particularly bode well for the exercise itself. Even though INEC has said, no mask, no vote. Do you think this is working? Do you think this itself is working? Because we're talking about opening up. The elections are part of the opening up process, because if we didn't open up, they probably wouldn't be able to conduct elections. Are we doing it well, given the example of Edo, for example?
Well, to a large extent, we've been quite lucky because when we see how much we've not quite done well in terms of many of these gatherings, I mean, we should be more careful. So what we can really do is to ensure that that process is safely done. It can't be business as usual. And so every step of it has to be thought through. Obviously, you can't even say it's not going to happen in terms of the election. So apart from people wearing masks, ensuring that people, wash their hands before they go in, use hand sanitizers, maintain that distance, making sure that when people get there, they do what they have to do and they
go away.
They go away immediately, because the longer we stay together and you're not sure of the other person, the more likely transmission, if that is the case. So we'll just have to keep encouraging that that is done. And those that are officials too should do their job and also make sure that they protect themselves and they show others what to do in terms of wearing masks. And all
that brings me to the general question of compliance. Mm-hmm. We have discussed this, me and you, and a whole host of us over the last 6-7 months. Would I be wrong in saying that situation has not improved?
It has gotten worse. Compliance, there's lots of fatigue with respect to compliance. I mean, with the schools reopening, it kind of brought it up again that let's do this, children should wear masks, teachers and all of that. But in the marketplace, out there, the compliance is really...
If the parents are not wearing masks, how can they compel the children to wear masks? Because it's a question someone asked. We said, look, Daddy, you guys are preaching that people should wear masks. Mm-hmm. You can capture the children and force them. But they'll be pointing fingers at and saying that, but Daddy is not wearing, Mommy is not wearing, Auntie is not wearing, why should I?
And we should always show good examples. When you go somewhere, in fact, now it's the other way around. When you're wearing a mask,
people point fingers at you. That's it.
Why are you wearing a mask? It's all over and all of that. But of course, these children are mixing with other children. And that is what is important, why they must keep safe and wear a mask. And we don't want, if adults are adults, but children are children, we want to do the best for them. But as parents, as teachers, as school proprietors, and all of that, we must show good examples ourselves before the children.
The president and indeed a whole host of others paid tribute to frontline health workers during the independence anniversary and all through the week that has followed. What is the situation, as you know it, with the welfare? And when I say welfare, I'm talking about the exposure to COVID-19. I know we've talked about it before. At the time, we lost quite a number of them. But it would appear that the training is better now. Some have gotten better handle of it. Is that reflective in the general practice?
So there is more access, perhaps, to PPEs. And maybe because people are able to test more, there's also, for scheduled procedures, people can actually do a test and before coming for procedures, except emergencies where you have no choice, and there's more compliance with ensuring that the doctors themselves use their PPEs appropriately, and all the health workers in general. Okay, but we should know that as long as the hospital is the go-to place for people when they are sick, the hazard remains. And so everything that needs to be done, including giving the necessary allowances and all the kinds of morale boosting, should be done for health workers to ensure they're safe.
So many people when we talked about schools reopening, there was so much effort and so much concentration on primary and secondary schools because the ones in that area are difficult to control. There are many of them and so on. But it does appear as if maybe we were focused on the wrong set of people, because at the level of tertiary education now, there's also some level of controversy because There are large numbers of people there. Those ones are even more difficult to control than the younger ones. What do you think should be done? Most of the tertiary institutions have not really reopened yet. They have other issues. But in reopening them, what should the administrators of those places, the health officials in charge of those places be trying to identify?
I mean, you're spot on, because you need to enter a typical lecture room. People are jam-packed in those rooms, so this was actually, I don't know whether it is or was actually the best opportunity to leverage technology, even with the higher institutions, where there can be a lot of hybrid learning, both in class and out of class. And that means that the university environment itself has all it requires, from Wi-Fi to smart classes to everything that makes such learning possible. Because our universities in other countries, some students have not resumed there physically. They're back here in Nigeria and classes are going on. So this would have been the perfect time, but it takes a lot of funding in that sector. So really what it should be done is not just by the university administrators, but even in terms of funding by the federal government, state government, and all of that. But within that system, they can look at it a little more to ensure that students can have morning classes and maybe later evening classes if there is power.
So many ifs.
So many ifs. But we still know that the students that come in are outstripping the facilities that are available, at least in the public universities. For the private universities, I'm not sure they have
the same problem.
And that's because of their number, and then they have a lot more space. And some of them even have these facilities that we have talked about. And such disparities between public and private come up in situations like this, and the government needs to step up to close that gap that already exists.
Dr. Okeuyami, we will continue to return to these themes as long as COVID is with us. But thank you for joining us this evening.
Thank you for having me.
Thank you so much for coming in. Let's switch gears and talk about the deployment of satellite applications targeted at prediction, monitoring, and raising public awareness, which may be the solution to curbing future health outbreaks globally. And that's the position of the Acting Director General of the National Space Research and Development Agency, Dr. Francis Chizia. Dr. Chizia, who was speaking at a meeting in Abuja, explains that satellite communications play a vital role in the monitoring, diagnosis, and quarantine treatment of persons infected with COVID-19.
The COVID-19 pandemic is ravaging the world and has caused unprecedented disruption in everyday life, ranging from work to the economy and general well-being. Since the outbreak of the disease in December 2019, government at all levels has been coming up with strategies to contain its spread. At this event, which brings together space scientists, the need for the adoption of satellite technology to predict and monitor future disease outbreaks is being canvassed.
The health sector has always been affected due to shortage of doctors and facilities, thereby increasing the demand for facilities or satellite-based platforms such as telemedicine for consultation and administration of treatments for patients during this period.
The decisions of the government and regulators to ensure certain and continued access to key satellite bands frequencies remain instrumental to the satellite industry's ability to continue to provide these essential services in support of the crisis.
The COVID-19 pandemic has resulted in food and income shortages and an increased rate of internet fraud. Besides containing the spread of COVID-19, the need for the government to deploy satellite technology towards addressing the nation's security challenges also forms a major point for discussion.
We have 3 satellites, 2 Earth observation satellites, Nigeria Sat-2 and Nigeria Sat-X, and a communication satellite, niche concept 1R. That's a communication satellite. So when you combine communications with Earth observation, you find out that you're almost covered. Because Earth observation does a lot for farmers, detecting flood areas, fire, and of course, even the spread of COVID-19.
The COVID-19 pandemic highlights the role of science and technology as a major tool for productivity and growth. With more support from the federal government, the sector can only get better at contributing its quota to national development.
Outside our shores, the U.S. presidential election is only weeks away now, and the candidates have pretty limited time to campaign before everyone heads to the polls on November the 3rd. Therefore, every minute counts, right? While it appears both presidential candidates are looking at this differently. A few debate rules have changed because of the COVID-19 pandemic, resulting in the decision to take the next presidential debate virtually. President Donald Trump has refused to take part in that debate, which will be televised, but would not require both candidates to be in the same room. The president's comments were made during a phone-in interview with Fox Business Channel earlier today. The interview touched on a number of key matters, including his health and the possibility of movement towards a stimulus package for the economy. Confined to the White House, where he is being treated for COVID-19, the U.S. president said he does not believe he is contagious and is feeling good enough to resume campaign rallies as he tries to boost his re-election bid.
Waste my time on a virtual debate. That's not what debating's all about. You sit behind a computer and do a debate. It's ridiculous. And then they cut you off. I'll be tested very soon, but I'm essentially very clean. So what I'm going to do is take Regeneron and take the Eli Lilly equivalent.
How long will you be taking them?
I've stopped. I don't take them anymore. No, I don't take them anymore.
Okay.
I think I'm taking almost nothing. I think I'm finished with just about everything. I think you go a little bit longer on. They have a steroid. It's not a heavy steroid. I don't think I'm contagious at all. Well, first of all, if I'm at a rally, I stand by myself very far away from everybody. So whether I was or not, I met with Gulf Star families. I didn't want to cancel that, and I can't back up, Maria, and say, "Give me room. I want room. Give me 12 feet. Stay 12 feet away when you touch." They come within an inch of my face sometimes. They want to hug me and they want to kiss me.
His Democratic challenger, Joe Biden, says he will follow the recommendations of the debate commission on how to proceed following President Trump's comments. Mr. Biden had previously been wary of an on-stage event, but said that he would attend if medical experts gave the go-ahead.
I thought Kamala did a great job last night. She was really presidential. She kept it on focus. I was really proud of her. I'm looking forward to seeing her. We don't know what the president's going to do. He changes his mind every second. So for me to comment on that now would be irresponsible. I think that if I'm going to follow the commission recommendation, if he goes off and he's going to have a rally, I don't know what I'll do. It depends on we don't know enough to know right now. My inclination. I'll talk to you later about it. I don't know. I'm just hearing the same thing you're hearing as we're going. You never know what's going to come out of his mouth. Who knows? Thank you.
While that is going on, the U.S. vice presidential debate held last night at the University of Utah in Salt Lake City. And the issues covered ranged from COVID-19 to the economy and then to foreign policy.
U.S. Vice President Mike Pence and his Democratic Party challenger Kamala Harris clashed on Wednesday night over the Trump administration's handling of the coronavirus pandemic.
And they knew what was happening and they didn't tell you. Can you imagine if you knew on January 28th, as opposed to March 13th, what they knew, what you might have done to prepare? They knew and they covered it up. The president said it was a hoax. They minimize the seriousness of it.
I want the American people to know that from the very first day, President Donald Trump has put the health of America first. Before there were more than 5 cases in the United States, all people who had returned from China, President Donald Trump did what no other American president had ever done. And that was he suspended all travel from China, the second largest economy in the world.
The two candidates were separated by 12 feet and plexiglass shields, a reminder of the virus which has led to the largest public health crisis in the country. Then they delved into the economy and taxes.
More taxes, more regulation, banning fracking, abolishing fossil fuel, crushing American energy, and economic surrender to China is a prescription for economic decline. President Trump and I will keep America growing. The V-shaped recovery that's underway right now will continue with 4 more years of President Donald Trump.
Joe Biden will not raise taxes on anyone who makes less than $400,000 a year. He has been very clear about that. Joe Biden will not end fracking. He has been very clear about that. Joe Biden is the one who, during the Great Recession, was responsible for the Recovery Act that brought America back, and now the Trump-Pence administration wants to take credit when they rode the coattails of Joe Biden's success for the economy that they had at the beginning of their term. Of course, now the economy is a complete disaster.
Questions were also asked on foreign policy, with specifics on whether China is regarded as an adversary or friend of the United States. And who else is a friend of the United States?
Donald Trump, the commander-in-chief of the United States of America, prefers to take the word of Vladimir Putin over the word of the American intelligence community. You look at our friends at NATO. He has walked away from agreements. You can look at the Iran nuclear deal, which now has put us in a position where we are less safe because they are building up what might end up being a significant nuclear arsenal. We were in that deal, guys. We were in the Iran nuclear deal with friends, with allies around the country. And because of Donald Trump's unilateral approach to foreign policy, coupled with his isolationism, he pulled us out and has made America less safe. So, Susan, it's about relationships. And the thing that has always been part of the strength of our nation, in addition to our great military, has been that we keep our word. But Donald Trump doesn't understand that because he doesn't understand what it means to be honest.
Well, President Trump kept his word when we moved the American embassy to Jerusalem, the capital of the state of Israel. When Joe Biden was vice president, they promised to do that, and they never did. We've stood strong with our allies, but we've been demanding. NATO is now contributing more to our common defense than ever before, thanks to President Trump's leadership. We've strengthened our alliances across the Asia-Pacific, and we've stood strong against those who would do us harm. You know, when President Trump came into office, ISIS had captured an area of the Middle East the size of Pennsylvania. But President Trump unleashed the American military, and our armed forces destroyed the ISIS caliphate and took down their leader al-Baghdadi without one American casualty.
Later in the debate, it was noticed there was a fly on the vice president's head, which sat there for a while. Harris, a U.S. senator from California and the daughter of immigrants from Jamaica and India, was on the biggest stage of her political career, while Mike Pence, a former conservative radio host, former congressman and former Indiana governor, has been defending Trump throughout his presidency. It is yet to be seen how much of an impact this debate has made on Americans as they head to the polls on November 3rd this year.
At least 338,779 COVID-19 cases have been recorded today by the World Health Organization, making it the biggest one-day increase since the pandemic began. India, Brazil, and the United States each had 78,524, 41,906, and 38,904 cases. This comes as U.S. health officials say there will be enough vaccines against COVID-19 for every American who wants one by March or April of next year. Here's our global update.
U.S. Health and Human Services Secretary Alex Azar was giving the prediction at a Goldman Sachs healthcare virtual conference earlier today. There are around 40 different coronavirus vaccines in clinical trials around the world. Several U.S. companies are developing vaccines that are currently in the crucial Phase 3 stage of clinical trials. The government has chosen 3 candidates to fund for Phase 3 trials under Operation Warp Speed, its plan to fast-track coronavirus vaccines. In the United Kingdom, a further 17,540 coronavirus cases have been recorded across the country, according to data from the government's COVID-19 dashboard. It means a total of 554,275 lab-confirmed cases have been recorded in the country since the pandemic began. The world's largest annual religious gathering is in full swing and is posing formidable health hazards for Iraqi authorities already struggling with a spike of COVID-19 infections. Tens of thousands of pilgrims, many without face masks and seemingly oblivious of government's health guidelines, cram closely together as they queue for security checks, while giant cooling fans blow air across the crowd. However, dozens of teenagers with tanks for disinfection on their backs frantically spray visitors, but miss many because they are completely outnumbered. Sweden says it will postpone plans to let more people attend sports events and concerts, citing rising coronavirus infection numbers both within the country and around Europe. The government said in August it intended to raise the limit for some events to 500 from the current 50. However, with the numbers clearly rising in the country, the government says it will have to postpone the move. Finally, a United Arab Emirates company is nearing the end of Phase 3 clinical trials of a Chinese COVID-19 vaccine and hopes to manufacture it next year. The trial, which began in mid-July, is a partnership between Sinopharm's China National Biotech Group and Abu Dhabi-based artificial intelligence and cloud computing company Group 42. The vaccine has been administered to more than 31,000 people in the UAE, Egypt, Bahrain and Jordan.
And that's our COVID-19 update for tonight. You can take a good look at some of the numbers you've heard during this program by visiting our website, channelstv.com. You'll get other updates and, of course, a better understanding of all that is needed to stay safe during this period. Of course, there are other stories on politics, business and sports. And we'll have fresh packages of the program tomorrow at 6 and then at 9 p.m. Thank you very much for watching. I'm Ade Okeuyami. Good night.